Hi everyone, I'm Dr Harmeet Singh and welcome to this presentation. Today we are going to talk and discuss air pollution and its side effects. The objectives of this talk will be definition of air pollution and types of air pollution, what is AQI, and the range of the AQI, to analyze body system wise impact of air pollution, and to list preventive measures against air pollution. So what is air pollution? Air pollution is the presence of harmful substances like gases, liquids or solids which are harmful to the humanity, animals, human beings. Usually the air is called pure if it is free from these pollutants. Composition of air. To understand the pollution, we all should know that actually what are the factors, what are the components of the air. So nitrogen 78%, oxygen 21%, other gases are very minimal 1%. The air's balance is disrupted by pollutants. Causes of air pollution and the sources of air pollution. Mostly there are a lot of causes and sources of air pollution, but most commonly which is in our hands where we can control the air pollution are automobiles, industries, domestic sources like cooking, heating, dust and burning of fossils. These are the components or the issues which are in our hands to control. Types of air pollution depending upon the pollutants is direct and primary and secondary. The primary is where the pollutants come directly from the source like carbon monoxide, SO2, NO2, PM and VOCs. And the secondary is formed by chemical reactions like ozone or smog. So the examples of major air pollutants are carbon monoxide, sulfur dioxide, nitrogen oxide, particulate matter, PM10 or PM2.5, which are very important when we measure the air pollution, volatile organic compounds and ground level ozone O3. Indoor versus outdoor air pollution. So the pollution which is outdoor is due to the vehicles like cars, two-wheeler, four-wheeler, trucks, buses and any kind of vehicle. Industrial are the most common source nowadays. You can see the industrial area should be away from the cities. एग्रीकल्चर इमिशंस लाइक आपने देखा होगा कि पंजाब में इट्स ऑलवेज इन द एज अ पॉलिटिकल इशू व्हेन देयर इज़ पोल्यूशन इन द सिटी ऑफ दिल्ली एंड वो एलिगेशन होता है कि दूसरी स्टेट से पराली जलाई गई है एंड देन उसका धुआं इधर आ रहा है. इंडोर कैन बी फ्रॉम सिगरेट स्मोकिंग, कुकिंग, बिल्डिंग मटेरियल्स और डस्ट. जो हम झाड़ू देते हैं डेली उससे भी जो डस्ट होती है दैट इज आल्सो पोल्यूटेंट. सो AQI, एयर क्वालिटी इंडेक्स, very important index which is used to measure the air quality. AQI is calculated based on the concentrations of 5 major pollutants. 1, ozone O3, second one is particulate matter PM2.5 and PM10, third is nitrogen dioxide, fourth one is sulfur dioxide and fifth one is carbon monoxide. The more these components in the air, the more is air pollution and the less healthy and very dangerous for the human being. So this is the meter how we measure the best air AQI which is healthy for the human being, for animals, for birds, for everyone, is less than 50. It's green. Moderate colored yellow is between 50 to 100. If AQI is between 50 to 100, it is moderate, and more than 100, less than 150 is called unhealthy for sensitive groups like COPD, asthma, ILD patient, children, or elderly people. More than 150 and less than 200 is totally unhealthy. So in these situations, we should not go out. More than 200 and less than 300 is very unhealthy, which is very common in Delhi like cities, and more than 300 is hazardous. So nowadays we see that our AQI in Delhi and NCR is more than 300. So this is the air which is not suitable for human being or for animals even, or for the birds to live. So better is to avoid going outside. So what can be the effects on our body? Let's take one by one. Respiratory system. So the symptoms because of this air pollution can be shortness of breath, asthma aggravation. A person is having already asthma, COPD, he or she can have the aggravation of the asthma, COPD. Lung cancer risk, it's a risk for lung cancer. Effects on body like cardiovascular system, it affects on the blood vessels. So there is inflammation in the blood vessels, which can lead into the constriction of the blood vessels, leading to the high blood pressure, and which can lead into also the heart attacks and arrhythmias. In the nervous system, there is decline in the cognitive system, and your thinking power is decreased, your normal activities are decreased, you will feel always lazy and tired. Increased stroke risk. Neurological disorders like neuropathies, burning sensations can be there, or suppress the immunity, and which can lead to the higher infection rates. Effect on eye, nose and throat. There is irritation in the eyes, in the nose, in the throat, can lead into the redness and soreness. Allergic symptoms can occur to a human being, or there can be nasal congestion. Effects on other organ systems like kidney, which can damage the kidney, long-term exposure if it is there. And mostly we all have the long-term exposures because we all live in the cities like Delhi, NCR and other big cities where pollution is at the top. Impact on reproductive systems, which can lead into the infertility or abortions. The more vulnerable group of people is children, elderly, pregnant women, or pre-existing respiratory or heart condition people. So this is recommended that if the air pollution AQI is very high, and the children should not go outdoors, elderly people should not go out, pregnant women should not go, and be very careful going out. Preventive measures, very simple and everyone knows about it, is use mask in high pollution areas, avoid outdoor activities on high AQI days, use air purifiers indoors, and ventilate your rooms, mostly when at the time of between 11 to 2 when there is sun is there, and we should open our windows so that there is ventilation. Avoid dusting in the morning and in the evening, and do the dusting of your rooms, houses, homes mostly in the midday. Let's talk about the community and policy. Preventive measures. So promote public transport over the private vehicles. So if we all start using the public transport, then the number of vehicles on the roads will be less, and which can directly affect the AQI. Second, enforce emission controls, which is very important in our hands, and encourage clean energy like solar and wind. The fourth one is recycle and reduce waste. These are all the measures which is in our hands, and we can use it, we can adopt it, and we can contribute to the community, to our population. Now, very important role is played by the plants. So we have seen that a lot of people, they like to have the plants around them and in the balconies, in the rooms. So there are some plants which helps us reducing the air pollution. Number one is spider plant, removes formaldehyde, xylene and toluene and is easy to care for. Snake plants, good at filtering formaldehyde, benzene, xylene, toluene and nitrogen oxides. These are the factors, these are the elements which are in the air and they make the air polluted. Peace lily absorbs formaldehyde, benzene, trichloroethylene, xylene and ammonia. It requires moist soil and indirect light to grow. Very easy to have these plants, to take care of these plants. Aloe vera plant, very important, removes formaldehyde and benzene, releases oxygen at night, so you can keep it in the room in the night. Weeping fig, reduces adhesives and paint related chemicals in the air. Plants like Boston fern efficiently removes formaldehyde and xylene, prefers humidity. English ivy, it's effective against formaldehyde, benzene and airborne particles, suited for bathrooms. Rubber plant also absorbs formaldehyde and is adaptable to different light conditions. Golden pothos removes formaldehyde, benzene, xylene, toluene, very low maintenance, so you can easily keep it in your rooms. Bamboo palm and chrysanthemum, these also clean chemicals from paints and glues and offer colorful appearance. So how do plants work? How do they purify the air? Very simple, through photosynthesis. These plants absorb toxins like formaldehyde, benzene, ammonia and release oxygen. They are free air purifiers. They break down pollutants at leaf and root level, improving overall air quality indoors. Many are resilient, decorative and require minimal care, making them suitable for homes, offices and public spaces. So my recommendation is to keep all these plants around you so that you can get a pure and fresh oxygen air. At the end, the take-home message is air pollution is a major threat to global health. It is an alarming health emergency nowadays in our city like Delhi, NCR, where we need to take care of ourselves, our family, our relatives, our children, requiring both individuals and collective action for prevention. Government can make the policies, but everything is in our hands. We can control it ourselves. Awareness, behavior change and policy enforcement are essential. Prevention is better than cure. Keep air purifying plants around you. Even you can use the air purifier which is readily available in the market. But the small things which lead the air pollution is under our control, which we can avoid, and we can make our air around us pure, free atmosphere from pollutants, and live longer. Thank you so much for joining us and listening the air pollution, and take care of yourself. Thank you.